Now we come to the inguinal canal. Inguinal canal is a canal which is developed better in the case of males, because testis has to descend down, because spermatogenesis takes place at a lower temperature, so testes are hanging in the region of the scrotum. The inguinal canal is a canal which is 4 centimeters long, above and parallel to the medial half of the inguinal ligament. The floor is formed by the inguinal ligament and the lacunar ligament. The roof is formed by the fibers of the internal oblique muscle. The anterior wall is formed by the aponeurosis of external oblique, supplemented by internal oblique in the lateral half. The posterior wall is formed by the fascia transversalis and conjoint tendon in the medial half. Most important contents of the spermatic cord is the ductus deferens, which is a muscular tube present inside the spermatic cord. Besides that, it has arteries, the testicular artery, cremasteric artery, and artery to the ductus deferens. Besides these vessels, it contains an important plexus of veins which is known as the pampiniform plexus. This plexus forms the testicular vein which drains into inferior vena cava on the right side and into the left renal vein on the left side. The ductus deferens passes up at the deep inguinal ring. It crosses the pelvic brim and the vessels, external iliac vessels, and enters the true pelvis. In the true pelvis, the ductus deferens crosses the ureter anteriorly and goes at the base of the bladder, and then it joins with the duct of the seminal vesicle to form the ejaculatory duct, which opens into the prostatic part of the urethra. There are coverings of the spermatic cord. These are external spermatic fascia derived from the external oblique muscle, the cremasteric muscle and fascia derived partly from the internal oblique, and the transversus muscles of the abdomen.